If we talk with the skin, so which parts are there? This, your jawline, the lower margin of the mandible, here the angle of the mandible. From here you will have to make a bony jump from here to the mastoid process, this line, and from the mastoid process go on to the superior knuckle line and external occipital protuberance, and then you will do the same on the opposite side. So anatomically speaking, this is the line that is defining the neck: mandible, angle of mandible, mastoid, superior knuckle line, external occipital protuberance. In the lower aspect, which are the structures that are lining it? Here, the upper margin of the manubrium sterni, that is the jugular notch, because it is present between the two ends of the clavicle. Then there is the upper end of the clavicle palpated here. As you move along the clavicle, you will palpate the acromion process. As you move back, you will find the spinous process, and this whole ring, this area, this is called the neck area. It does not have a lot of surface markings that are important, just a few things. When you extend your neck, you are able to palpate the respiratory tract, the larynx above and trachea below. In males, in genetic males, the larynx is protruded anteriorly to form the Adam apple. This part. Here it is shown here. In the females, um, it is not present. On the lighter note, here is a joke. In the If someone is cross-dressed and you are confused about the gender, Adam apple is usually a telltale sign. So there are a lot of jokes in the dramas and the sitcoms that any trap will be having a turtleneck wearing that. Okay, jokes aside, you can palpate you can feel the rings of the trachea. You can feel the cricoid cartilage, thyroid cartilage of the larynx. I will go into the cartilages when we'll take the respiratory system. Just above the Adam's apple, you may be able to palpate the bone here, like this. Palpate your thyroid cartilage, feel the gap, and find the cartilage here. This is your hyoid bone. Just above the Adam's apple, there is a dip and a hard bone here. This is the hyoid bone that is palpated here. And the other prominent feature that is palpated, that is the sternocleidomastoid. When we look at one side, this prominent muscle is sternocleidomastoid. Here it is shown here, and it has two in origin sides from the manubrium and the clavicle, and there is a gap between them. It is palpated here, and in the back there is trapezius. The line here, that is the trapezius. ये वो जगह है जिसको आप कहते हैं ना पट्टे दबा दो, कंधा यहाँ से आप दबाते हैं, you are basically pressing on this free margin of the trapezius. And then this jugular notch and clavicle and acromion and spinous process. So these are the things that you can palpate. In addition to that, you can palpate the carotid pulse. To find the carotid pulse, get to the levels of the Adam's apple, upper margin of the thyroid cartilage, and move laterally here. You can see the pulse right here in front of the sternocleidomastoid, and pulse of the internal carotid artery is a guide to the internal jugular vein that is just lateral to it. And superficially here, the external jugular vein passes. In fair-skinned and thin people, this vein is prominent, especially when doing some strenuous work and some even at angry someone, the veins gets swollen up, so external jugular vein can be seen crossing the sternocleidomastoid. Okay, let's see the surface. This is the picture from Snell's anatomy. What is the cutaneous supply? Let us divide the back of the neck from front of the neck, and then we will the front anterolateral aspect into this. So I'm marking the line that will be dividing this. It is usually posterolateral aspect of the neck. So let's say behind it is the posterolateral aspect, front of it the lateral aspect, anterolateral aspect. Let's do the posterior aspect first. Behind this red line, the nerves supplying are coming from posterior rami. You remember when in a spinal cord, The nerves exit. There is a posterior root, there is anterior root. They join to form the common spinal nerve, and there is a one posterior ramus and there is an anterior ramus. It supplies the muscles and skin of the back. It supplies the lateral and anterior surface of the body. So this is it we are talking about. Um, okay, this is it what we are talking about. So this is back up to the vertex, the highest point. When you stand right and you check your height, the point you touch, this is the vertex. So up to the vertex, the supply is from the anterior aspect. That is from the. I'm not going into the detail of these nerves. These are the from the cranial nerve 5. Behind the vertex, the upper part, all the way the back of the your posterior half of the calvaria and your norma occipitalis. Back side and posterior half of the upper aspect. This is supplied by C2. This is supplied by C2 and it is known as greater occipital nerve. There is no C1. There is no C1. होती नहीं है. There is no C1. There is no cutaneous branch. No C1 का मतलब है no cutaneous branch of C1. There is a C1 nerve, but it does not have any cutaneous branch. So we are C1, then the C2 supplying the back, and as you move down, you will have 3, 4, 5 segmentally supplying the posterior ramus of the focus on the posterior ramus. So the back is the back of the back half of the superior surface, and back of the head is supplied by C2, known as greater occipital nerve, and it is the posterior ramus. And as we move down to the back of the neck, there is C3, C4, C5, and after C5 you will jump to you. After C5 you will reach here, the back of your trapezius muscle, roughly at the level of spinous process, and below it the levels will continue C6, C7, and so on. Let's look at the anterior aspect. Let's look at the anterior aspect. Anterior aspect, it is divided like a cross into 4 parts. It is divided like a cross into 4 parts, like this. So I'm removing them. You just remember these lines. So the let's say it like this: the nerve that is going anterior to the nerve that is going anterior to the ear, the nerve that is going from back of the ear. Here, एक minute, let me tell you one more thing. Just let me draw this. Here along this line, there is a muscle. There is sternocleidomastoid muscle right here, right at this line. See, so all of these nerves, the 1, 2, 3, they are emerging from the posterior margin of the sternocleidomastoid at the same point, and this is also emerging from the posterior margin of the sternocleidomastoid. So all 4 muscle nerves that I am going to discuss, this one, this one, this one, and this one, these are all branches of cervical plexus. We will discuss this in the last 2 lectures with the nerves. This is the cervical plexus. So now let's see where all of these 4 go. So after emerging from the the sternocleidomastoid, the let the 2 go up and 2 go down. The 2 though go up, one goes to the front of the ear, anterior to the ear, and one goes to the back of the ear. The one that goes to the anterior of the ear is called greater auricular nerve, and it supplies the lower aspect of the lower lateral aspect of the ear, part of the external auditory meatus. And keep in mind this part, the angle of the jaw. The angle of the jaw. It becomes important because all of the rest of the face is supplied by the trigeminal nerve, and this is the part that is not. So that is the greater auricular nerve. The smaller nerve that exits the posterior margin of the sternocleidomastoid at the higher level and goes to the back aspect and supplies whole of the medial aspect of the ear, inner aspect of the ear, medial aspect of the pinna, that is the lesser occipital nerve. Now, after emerging from the posterior margin of the sternocleidomastoid, there are some nerves that run anteriorly across the muscle and supply all the skin that is anterior to the sternocleidomastoid from chin to roughly and all the muscle that is anterior to sternocleidomastoid. Follow your sternocleidomastoid, so it will make a triangle like this. You will make a triangle like this. So this whole area from here to here, this triangular area wider above and narrower below, this area is being supplied by the transverse cutaneous nerve of the neck, because it is arising from the posterior margin of the sternocleidomastoid and it is going transversely to the anterior aspect. It is moving, it is supplying this area. So this is the transverse cutaneous nerve of the neck, and we are left with the last nerve that is known as supraclavicular nerve. It arises from here and it moves and expands like this down here. So it expands like this in the midline. It supplies up to the angle of Louis. Otherwise, it supplies by the level of the second rib. So this is the part that is supplied by it. It is further divided into medial, intermediate, and lateral cutaneous branches. Lateral supraclavicular nerves C3 and C4. It branches this area. This is the topic of the thorax. Beyond that, because after that, the next dermatome is T2. There is C3, C4 with supraclavicular nerves, and just below this, there is T2. Where did all of the rest go? Where did C5, C6, C7, C8, T1 go? So this is the question for you. Answer me in the chat. This is a brain teaser for you. So these are the cutaneous nerves. Very quick revision. Posterior aspect, upper half by the greater occipital, lower part conjunctively by 3, 4 and 5. These are all from the posterior ramus. Anterior part, all of these nerves are rising from the cervical plexus. All of these are coming from the posterior margin of the sternocleidomastoid. The one, two that are going up, the one that is going behind the ear and supplying the medial aspect, that is the lesser occipital nerve. The one that is going in front in the lateral aspect of the pinna and external canal, that is the greater auricular nerve, and it also supplies the margin of the chin. The one that crosses the transverses, that transversely crosses the sternocleidomastoid and goes to the anterior aspect of the neck and supplies from chin to the jugular fossa, that is the transverse cutaneous nerve. And the ones that goes and spreads down over the pectoralis muscle medially and over the deltoid muscle laterally and supplies these regions, these are supraclavicular nerves. So moving from the picture of Snell to the picture of Gray's netters, you may be able to see a little these. These are the transverse cervical nerves expanding. This is the sternocleidomastoid giving. Don't be overwhelmed by the rest of it. You may ignore the rest. For now, we will do them step by step. And this is the supraclavicular nerves supplying the skin over the clavicle, over the pectoral, over the deltoid, up to the level of angle of Louis and second rib. If you look from the side, you will be able to appreciate the rest of the four. So the one that is going, the three exiting here from with each other, greater auricular on the surface of the sternocleidomastoid going to the front of the ear, transverse going to the front of the midline neck, and this is the supraclavicular nerve. It does not come to the lateral aspect of the sternocleidomastoid. You can see lesser occipital. It usually leaves the posterior margin of the sternocleidomastoid just at its point of origin here. And here you can see it is not labeled right now. You can see my pointer. This is the greater occipital nerve that will go up to the level of the vertex. So these are the nerves that are shown here. And all of these are present in the subcutaneous tissue. The subcutaneous tissue, it's the fat like all of the rest of the muscles, all of the rest of the body. It contains a muscle called platysma. I will go into the detail a little while later, especially in the muscles of head and in the muscles of the face. Platysma we will see there. But today we will discuss that today also. And the other thing that is present is the superficial veins. And the vein that is the most prominent vein that is present in the subcutaneous tissue is this one, the external jugular vein. External jugular vein is the one that moves superficial to the sternocleidomastoid. If you have been with me by now, you will have a little idea about now. These are all the structures that are on the lateral aspect of the sternocleidomastoid that will help you in the relations, establishing the relations also. There is one more vein in the superficial subcutaneous tissue. It is this. This is anterior jugular vein. It is not so prominent and not so easily identifiable, and it ultimately goes into the internal jugular vein. But there is a paired structure, one on each side, and it moves behind. It goes deeper and moves behind the sternocleidomastoid to go laterally and go into the internal jugular vein or the junction where it is falling into the subclavian vein.